Some of you have reached out to me and asked, why doesn't the Eustache work? What am I doing wrong? Well, I'm going to address those questions, but first I'm going to explain a little bit about eustachian tube dysfunction if you're new to my channel. Basically, our eustachian tube is a small canal about 1 1/2 inches long and runs from our ear, specifically our middle ear, to the back of the nose and upper throat. Most of the time, our eustachian tubes remain closed. However, when we chew, yawn, or swallow, the tubes open. The tubes are responsible for equalizing pressure from the inner ear to the outside world to ensure that they are the same. The following clip is going to give you an example of how the Eustache works, and I'm going to explain exactly why you may not be finding long-term relief while using the Eustache. So step 1, it's going to go up to the nose. You're going to plug the other nostril. Then you're going to push the power button on the device, and that's going to bring a little blowing air up your nose and hopefully opening your ear canal. It is described that you are to repeat the 3-step process with the other nostril. But the problem is that we have issues with something we're currently doing all the time in our day-to-day lifestyle. And of course, stress is not helping us heal as well. I can tell you I average about 10 emails a day describing the pain and sensations that come with having eustachian tube dysfunction. And most of you will be surprised that it doesn't always end up being an allergy-related problem, as well as sinus issues. Most of you are okay with these problems, but I have to tell you this. When you're dealing with eustachian tube dysfunction, I can tell you that there is a direct correlation with how much we tense up, how much stress we incur in our lifestyle, and how we deal with it. The confusion is that stress is a normal release of chemicals and hormones responding to what we're doing in our lifestyle. What I'm getting at is there is no absolute way to 100% eliminate stress in our day-to-day lifestyle. But we have to be aware that stress is ultimately the cause of why we continuously have tinnitus and eustachian tube dysfunction. The main objective is we need to establish a way to minimize how long we hang on to that stress and what our triggers are. So when we are purchasing something called the Eustache, we assume that that's going to end most of our problems, and we are actually causing a lot of our problems. As you see here, poor posture is something that we're unaware of. And when we go and see a specialist or a doctor related to allergies, we are never told that posture is one of the key players in why we are still hanging on to these conditions. It is almost as if we need multiple specialists to help us with one condition. We need to get into our neck muscles and really stretch them out. I guess that has to be a chiropractor. We need to make sure our nasal passages are clear and we are keeping our triggers down. I guess that would probably be an ENT provider. As well as we need to be sure that we're taking time to keep our stress down, and I assume that would also be a general practitioner to help us with those related problems. That is why this condition is so troubling, because it has an array of symptoms that branch off into other specialties that doctors don't go into other specialties to talk about. Every provider of anything has to take time to briefly talk about other circumstances that may be causing the problem. So if you're going to see an allergist and you're having inflamed nasal passages, that would be something an allergist would talk about. But then when you start talking about your neck being stiff, the allergist will immediately refer to you to someone that deals with that problem. But unfortunately, it has to be talked about, and it's not when we're dealing with this problem of eustachian tube dysfunction and tinnitus. It's not to say that doctors have to completely take over a specialty that's not theirs, but it's something that does have to be talked about and addressed. Being a professional in that field, you have to talk about other parts of the body, even if you're not treating them, to allow education to sink in. Products like Eustache are not 100% to blame for the fact that you still have these conditions with the ear. It's just to show that those conditions are needing to be treated heavily, needed to be treated in other ways. And Eustache is a way to help with getting that clarity in your nasal passages, helping you do something called the Valsalva maneuver that is easily done if you're able to do it. But this device is supposed to help you accomplish keeping those tubes open if you cannot. So overall, this video is not to knock the effectiveness of Eustache, but to explain how deep eustachian tube dysfunction really is. It's more than just a sinus or allergy problem. It takes a multitude of things to try to figure out how to heal from this terrible condition.